Hi everyone, I'm Cindy Currier, Director of the Newberry Council on Aging. Welcome to our program today called Ready to Reengage. I'm here with Joanne McInnes, registered nurse, president and founder of Aberdeen Home Care, and we're going to discuss re-engaging into the world after the pandemic. Joanne, can you tell us a little bit about yourself?
Absolutely. Hi, viewers. Thanks for joining us today. It's really a pleasure to be with you. Yes, this is a crazy time, and we're sort of in the crazy time of what does it all mean? And you're struggling like I am, and like Cindy is, and like your neighbors are, with the information that you hear on the radio and on television. Do you trust it? What is your doctor saying? If your doctor is saying something different than your children are saying, you're getting mixed up just like the rest of us. So welcome to the club. You're not alone. Trying to figure out, a little bit about me. I'm a registered nurse of almost 40 years. I started my nursing career when I was 10 years old. Just kidding, wanting to make sure you're all paying attention. And I've had many places where I've been, but home care is really my passion and where I have been for the last 20 years. Aberdeen Home Care is a business in Danvers, and we take care of mostly seniors who wish to remain in their home and need support and help to do so. But we also feel a strong responsibility to the community, and we do a lot of in-person presentations, radio programs like this one, so glad that you're joining us today.
So I thought we could start, Joanne, maybe talking a little bit about the vaccines.
Yes.
Okay.
Yes.
If you can talk a little bit about how long they're effective, do we need a booster shot, things like that?
It's interesting to go into some towns. When you come into Danvers from whatever place you're coming, it says max the vax. And different towns used to say mask up or wear a mask community or something like that. So if you're following the news right now, some of the companies are talking about vaccinating children as old as 3 years old, that some of the vaccines have been found safe and effective for that age group. Right now in the United States, I think we're at age 12 and up. And most of the injections, most of the immunizations, other than Johnson & Johnson, are requiring a series of 2 vaccinations to get you completely vaccinated. I think it's really too early for us to know how long these antibodies last, as well as how long do your antibodies last if you've actually had COVID. People that have had COVID have said or have been told maybe you don't need to be vaccinated, your antibodies will carry you, and now they're actually encouraging people that have had COVID to go out and get the vaccinations. I imagine, just like smallpox, just like other, epidemic and pandemic diseases of the past, that a booster will be coming. I haven't heard anything in the news about it, but I think we stay tuned and get more information as that comes along.
Okay. How about, let's talk about masks. State of Massachusetts is stating if you've had your vaccine, your both doses, you're 2 weeks past that injection, that second injection, you do not need to wear a mask anymore. Comfort level for people is different. What are your thoughts on that?
It's interesting, viewers, I bet you're looking at us thinking, they don't have masks on, and as I was just looking at Cindy and I felt my own face, I thought, oh yikes, I don't have my mask on. I just came from TJ Maxx, where I walked in and they handed me a mask. So we're getting different pieces of information and input depending on where we are. If you are double vaccinated, you can make a choice in some places if you choose to be masked or not. If you feel afraid or you feel nervous, wear your mask. It's only a teeny little piece of either paper or cloth. If you feel more comfortable and you feel a sense of protection, wear the mask. There's no reason that you can't. If you forget your mask, do you need to get into a panic? Probably not. We all have masks in our handbags or our pockets or our jackets in our cars. We probably all collectively have 20 masks hanging around somewhere. So you'll be able to find one if you want one. Masks, it's interesting, so much is passed from our breath. Most viruses, the common cold, the flu, chicken pox, shingles, coronavirus, so many vectors of disease are passed through our airway. So as we have been wearing masks, you've seen, I haven't had a cold in a year. The flu was way down. Other communicable diseases that come from respiratory-borne illnesses are way down. It's not a bad thing. In Asia, they've worn masks for years because they're so tightly packed in some of these real urban areas. The Japanese in Tokyo have worn masks for a long time. So it does offer that level of protection about what you're breathing in. Hand sanitization. Well, wash your hands. All our mothers told us to wash our hands, but now we realize that the things on our hands are invisible. I always like to tell the aides that work, the caregivers at Aberdeen, and when I'm doing public speaking, picture every surface covered with peanut butter. And when you touch it, you've got peanut butter on your fingers. Well, you're not going to want to touch your face or touch your kids or touch your grandmother with this peanut butter on your fingers. The peanut butter is the invisible bacteria or virus particles that you've now picked up. Our skin is amazing. I mean, our skin is our front line of defense against everything. So what do we want to do? We want to keep it intact, we want to keep it moisturized, and we want to keep it clean. We are a culture of hands-on faces. We just are. Oh, let me scratch my eyeball and all the rest of it. So this is a great refresher about general hygiene between what we're breathing out and how close we are to people, as well as what's happening with our hands, especially in public places. Grocery carts and elevators and bank machines and all gas nozzles, all the other places where we're tempted to wear gloves. Let's just keep that hand sanitizer going. That's something I hope that we just take and run with and keep as a part of sort of our normal culture moving forward.
So, in talking about hand sanitization, maybe a little refresher for everybody on, I don't think everyone washes their hands for 30 seconds.
Right.
Could you maybe give a little
Right.
tutorial?
Well, the tutorial on that is to sing Happy Birthday. I think you can jazz that up and you can sing, Baby, it's cold outside. You can sing anything you want. Make it fun, but say, I'm washing my hands to keep myself healthy. I'm washing my hands for my grandmother. I'm washing my hands for my granddaughter. I'm washing my hands for my husband or my wife or whomever. It's really important. We rinse. We rinse our hands. We don't really wash them. I remember when I was in the OR in my nursing school rotation, and we had to do this whole scrubbing thing, and I thought, this is crazy. Well, it's not so crazy. Here's a little anecdote. Florence Nightingale was the first person who actually instituted hand sanitization between patients. And she was doing her own little study, and she noticed that when physicians went in and looked at wounds in particular, and went to see Mrs. Smith, and then saw Mrs. Jones, and then saw Mrs. Botticelli, and didn't wash their hands, Mrs. Botticelli ended up with an infection that Mrs. Smith had. And so she said to the physicians and the surgeons, I think you should wash your hands between patients. So there will be a quiz at the end of this program. This is not Jeopardy, but it could be. And so make sure that you write that down, Florence Nightingale.
All right, let's talk a little bit about being out in public.
Yes.
I'm afraid there's germs everywhere. I understand
Yes.
the hand washing thing, but
Yep.
is it okay to touch that grocery cart handle?
Right.
Is it okay to open the door, or do I need to have one of those little, either a paper towel or one of those little door
Wipes
handles?
or-
Yeah, whatever.
We have been terrified. We've looked at other people and all objects outside of our own control as the enemy. You see someone coming at you without a mask, and you're covering your face, and then you're holding things like this, or you're trying to grab a piece of paper. We've become terrified by the environment around us, and that's really what I want to address with you today about the fear factor. It is safe to re-emerge out of your bubble. Remember, we were all talking about our bubbles and what was safe and how many people were in our bubble. You've heard a lot about herd immunity. I'm not sure that we're at herd immunity, but in Massachusetts, we're in a very fortunate position that many people have been vaccinated. It's summertime. We're outdoors. The very best, safest place for you to be is outside, where there's a great volume of air. This would have been too close prior to vaccination. We're both double vaccinated, so we're very safe sitting together. We're in a very large room that has good air circulation. That's another point of safety. But if you're in church and you're sitting in front of the choir and everyone is singing at you, well, those early on were the places where people were getting sick. It is safe to go to the grocery store. They are still, still see them sanitizing all of the handles. You can do your own. If you feel more comfortable spritzing everything and doing it, do it. We need to tailor-make your comfort level and our comfort level with re-engaging with the world around us. The very worst thing we can do is stay isolated. Being isolated is incredibly unhealthy. Looking at the mental health crisis that's happening to the young people right now, the emergency rooms are full. All of the hospitals are full. There is no therapist available for any children that are in crises, and a lot of kids are. And so if we take that off the children, we move that along, maybe the seniors in our community aren't presenting with some of those more dramatic symptoms, but they're feeling that existential aloneness or that fear of others and wanting to just hibernate. It's June, it's spring, it's coming to summer, it's time for us to branch out. How do you branch out safely? Well, you choose where you go. You know, you may not want to, I know the Esplanade isn't having the 4th of July, and I know we aren't going to that, but you don't want to put yourself in an incredibly condensed place where there's a lot of people and you can't control who's around you. Can you go to the grocery store? Yes. As you start to walk down the aisle that no longer has the arrows and you see 10 people in front of the popsicles, just don't go down there. Go get your cereal or go down to the produce department. Also pick when you go places. If you can go places early or at times that, not on the weekend, times that aren't so busy, just strategize and think out how can I make myself as safe as possible. The danger that was with us 6 months ago is no longer the same danger. It's still out there, COVID's still happening, but at such a lower incidence rate, and many people are vaccinated. So it is safe to come to the Council on Aging. It is safe to come for bingo. You're going to wash your hands. It's going maybe be outdoors. The doors and the windows will probably be open. There might be some people wearing masks, and that's okay. Might be you, might be me. Whatever you feel comfortable with, do. But you're in a much safer place. You don't need to feel like every time you emerge out of your home, you're perhaps going to be breathing in a death sentence. We're just not at that place anymore.
So you spoke about isolation.
Yes.
A lot of our seniors clearly have suffered from that, from isolation during this pandemic. I want to go see my friend. I want to have my friend come to my house. I want to go see my grandchildren.
Indeed.
We're safe to do so.
Yeah. Have a frank conversation. You know, are you vaccinated? I am double vaccinated. Mary, are you vaccinated? And if that's the case, your risk is very low. Could we go to lunch and sit outdoors? Could we meet and sit in the yard, or pop the windows open and don't sit very close together? Yes, those are the things that will keep you safe. What I hear is my grandchildren are in daycare. They obviously have not been vaccinated. They're around other kids, and I don't know if their kids' parents and grandparents are vaccinated. So maybe I'm 2 or 3 generations for somebody who might have COVID. How much risk am I at? Especially with kids who are, say, under 3 and, you know, can't keep their hands off of anything. How was that, huh? Did that grab your attention? So that's something that you need to consider and have a frank conversation, because many of our senior friends have underlying medical conditions. They have respiratory conditions, autoimmune problems, maybe they've had organ transplantation and they have steroids on board, and their immune systems just are not what they could be in order to protect them enough. And so there's not one answer, in other words, to who's safe and who's not. It's a variety of factors, and you kind of need to go through your list and have an honest conversation with your daughter and say, what's going on at this preschool? You know, does it seem safe to you? Because obviously we don't want to put me at risk.
So frank conversations, I understand that. Some people are very comfortable having those kind of frank conversations,
Indeed.
saying, hey, Mary, are you vaccinated?
Yep.
Other people, it's a little bit more difficult.
Right.
What's your sort of strategies for them?
I always like to blame someone else. So I'm going to suggest that you can say this: my nurse, and you can tell them it's me if you want to, or my doctor, my PCP, or I've been told that I should ask this question. Then it's not coming from you. You're not feeling so threatened by me. Are you vaccinated,
right.
Cindy? You know, so you're just going to say, I've been told that I should ask this question, or you know, my nurse told me to ask this question, and I hope it doesn't offend you, but I'm just going to throw it out there.
Okay, I like that. We talked about sitting in church, the choir is singing, blah, blah, blah. Religious services are resuming in person.
Yes.
In an enclosed space. Are we good to go?
The church that I go to, you have to register online, and so you sort of have to get your name on a list, because they're not doing full capacity. They might be at 50% capacity, and I don't know if they're singing. I know the choir is singing, and they're blocking off the front rows away from the people that are, you know, and all the singers are wearing masks. So I think those kinds of situations, they're still not, they don't look like the restaurants. The restaurants are fully open, no masks. The staff are wearing masks, and you'll find that in places that don't demand the general public wear masks, in stores, retail establishments, restaurants, what have you, that the workers are still masked. And that seems like a good idea to me. I mean, I think that's prudent.
Yes, I mean, they're the ones having sort of constant contact with
Indeed.
other people. You're in there for maybe 15, 20 minutes
Right.
in the grocery store or whatever, and you're in and out.
Yes.
What other things besides wearing masks if you want to, hand washing,
Mm-hmm.
vaccination, other things we can do to stay safe?
Let's think about like what our regular routine was like before if COVID, if you can even remember that. So you thought nothing of jumping onto the van at the Council on Aging and going grocery shopping. And you know what you got out of that besides your groceries? You got a little ride, and you got a little socialization with the people that were also going shopping, and you could bump into them in the grocery store, or you could play Zoom with your wagons and see who could get down the aisles fast enough. But you had this social outlet. And yeah, it's not a big deal, it's grocery shopping, but it's a valuable social outlet. Everything we do, even when we see people, dating myself, at the toll booth, or somebody who hands you your coffee through the drive-thru, all those little social interactions remind us that we are a relationship-based race of beings. We thrive on relationship. We thrive on social interaction. We've all been apart from that. I think people that are hugely introverted are probably, this is awesome. This was working for me. I don't have to talk to anybody. And then, there are the extroverts who are probably talking to me right now, trying to get my attention, but I can't hear you. But the social value of what we used to do, go to church, go get our nails done, go to the hairdresser, all the places that brought us into the public arena were meaningful social interactions. Many women, and probably men too, have the same hairdresser for a very, very long time. They know you, your kids, your story, and to touch base with those people and get that cord reconnected is really important. That's one thing I think we've really lost. And I'm going to encourage everybody, let's try to take some baby steps out. I don't want you to have to leap back into everything you were doing, but let's try to increase that comfort level in here and take those little baby steps so that we can build more confidence.
And that's what we're starting to do at the Newbury Council on Aging. We're taking it slow, offering the van to go grocery shopping. If you want to, it's available. We're here for you. Offering some outdoor programs. We're going to start offering indoor programs,
Good.
but I want people to understand that we are a safe environment to come to. And again, that socialization, we want to keep in contact with people. So we're offering things remotely, things like this,
Right.
where you can still stay at home and still get updated information. But also, we will be doing things in person. But we want to encourage people to come join us, and we're here if you need anything.
Let's talk for a minute, Cindy, about the information overload. You can still put on the news every night and get all these COVID updates and all this information, and it feels after a while like it's just pounding into you. And I know for most of us in the beginning of COVID, we heard things like masks aren't necessary, masks are essential. We're going to be taking the plasma. The plasma, that's going to be the answer to all of it, the antibody plasma. And then, no, we didn't hear about that so much. The vaccines are not safe. The vaccines are safe. So we're all overwhelmed with all of this input, and we're trying to figure out what makes sense. I know of situations where a physician has given two completely different answers to the same question, probably based on what the new information was that day or that moment. We're all in that same boat. Just lost my train of thought. Sorry, you're going to have to edit that out. Where was I going with that? About information.
Overload.
Oh, overload. Protect yourself from some of that. I mean, go to the sources that you really know. Every time People magazine pops up, or you get some crazy thing on, if you're into social media or in the newspaper, that so and so says this about that, question that. I mean, all these way out there claims, they're out there for a reason. We know the basics that we need to know about the virus, but you can get in a situation where you become paralyzed. It's not just fight or flight, it's fight, flight, freeze. And a lot of us were in that freeze place where we just got stuck and we couldn't move. And maybe some of you are now thinking, I'm safe at home, I'm safe at home. They told us to stay at home. Well, they told us that a year ago. And that stays with us because we were so terrified. And now they're saying, and we're saying, take a step, take a baby step out. What better, safer place to come than the Council on Aging? I mean, you've got Department of Public Health here in town. You've got people that are paying close attention to what the Centers for Disease Control, National Institutes of Health are saying about distance and airflow and the time that you can spend together, what's enough time, what's too much time. They're not just throwing these things together and saying, oh yeah, why don't you come down and play Twister on the floor. No, this is carefully thought out and strategized about how to keep people safe. Have confidence in the people right here who are looking at this from a safety perspective and a wellness perspective and a happiness perspective, because we have to be able to start to season our life back with a little happy.
I love it.
Yeah, there you go.
There you go.
All right. Well, I'm pleased to have been with you today. I'm Joanne McInnes from Aberdeen Home Care. I'm going to tell you how to get all this information will be available probably on your site.
Correct.
Why don't you tell them what your site is?
We're at townofnewbury.org, and you can click on the Council on Aging tab, and you'll get right to our website.
Good. And we are Aberdeen at Home, not the A symbol, the word at. AberdeenAtHome.com. And you can just scroll down on the bottom of our website, and this information is printable for you. And there'll be other links to things that we've done, COVID related and so forth. So, and if you have questions, there'll be an option for you to do an email directly to me, and I'm happy to email you back. I'm not a COVID expert. I'm not a doctor in public health. I have been on the forefront of COVID since it started on the local radio show, radio station, North Shore 1049. I was doing a daily COVID update for 3 months. 3 months. Well, so I am up to date on what's going on. So if I can't answer your question, I'll be absolutely honest with you and direct you somewhere else. But if you just need reassurance or you just like to chat about it, feel free to call, and all that information is available at AberdeenAtHome.com.
You can also call me at the Council on Aging, 978-462-8114. I'm happy to connect you with Joanne, or if you have questions for us, we're happy to help. Thanks
Great.
so much for joining us.
Thanks for having me today.
You got it. Thanks for coming.